Okay, so there is a lot of flu going around right now, and it's literally everybody. Everybody coming in with like a cough and a fever and stuff. They're all flu. Everybody is flu A this year. It's crazy. Like usually at this point, like pre-COVID, we'd be like, okay, we're not testing anybody anymore because it's all flu A. Like, just assume it's flu. So here's just a couple like tips and tricks to take care of your flu at home, so then maybe you don't have to go to the hospital. Basically, these are the discharge instructions I give to people when they're diagnosed with the flu. First and foremost, lots and lots of fluids. Grab your favorite big cup, fill it with water. I put flavoring in it so that I drink more. I just use stir. You can use whatever. Throw in a Crystal Light, throw in some liquid IV. I don't really care what you do. Whatever you do, hydrate, hydrate, hydrate. Next, if you have a fever, and a fever is 100.4 Fahrenheit, 38 degrees Celsius or higher, if it is under that, it's not a fever. Don't come at me. This is not for discussion. A fever is 100.4 Fahrenheit, 38 Celsius or higher. Anyway, if you have a fever, you can take Tylenol and or Motrin. If you have a complex medical history, please check with your provider first before you take any of these medications. That way you know you're taking the right one for you. You can alternate Tylenol and Motrin every 3 hours. So you take Tylenol at noon, you take Motrin at 3, you take Tylenol at 6, you take Motrin at 9. You can alternate them to keep that fever down and keep the body aches away. That's totally fine. If it's a child, those two medications are weight-based, so make sure you have an up-to-date weight on your kiddo and you're giving them the right amount, because a lot of people actually underdose their children and then are bamboozled when the fever doesn't go away. Remember, no Motrin for children under 6 months of age. Let me repeat that. No Motrin for children under 6 months of age. Got it? If your baby, 3 months of age or younger, has a fever, 100.4 Fahrenheit, 38 Celsius. If your baby under 90 days has a fever, take them to the emergency department. Ideally to one with a children's unit of some sort, whether it's a children's ER, a children's hospital, or at least a pediatrics inpatient unit. Please take them to a place with children's services. But if not, any ER will do. But if your baby under 90 days has a fever 100.4 or higher, take them to the hospital. Anyway, fluids. Tylenol, Motrin for fever, body aches. Other symptoms, just treat the symptoms. Stop with the combination cold meds, the Dayquil, NyQuil. That's just silliness, because they don't work and they're stupidly expensive. If you're congested, just use Afrin nasal spray or a nice hot shower, a good cup of tea, or the Hall's black package, like super extreme mentholy ones. I'll tell you what, that'll open everything up. If you have high blood pressure, remember you can't take those over-the-counter cough cold medicines. I know they make the high blood pressure ones, but let's be honest here, they don't work. For a cough or a sore throat, you can do things like Hall's cough drops. Ricola is personally my favorite, or a really good cup of tea. Delsam also works pretty well. There is a prescription medication called Tessalon Pearls that you can get from your primary care doctor. However, it's about a 50-50 chance whether they work for you. I think they're absolute garbage. My husband has taken them and thinks they're the greatest thing in the world. So, 6 of one, half dozen the other. Figure out if it works for you or not. Then you need to rest. You need to give your body a break. You need to post up in your favorite recliner, put a nice warm blankie on, and lay there, put a show on you've seen 900 times. Sleep when you need to sleep. Wake up when you feel like waking up. Make sure you're drinking lots of water and go up and pee so you don't pee yourself. That's it, but you need to do that for like 3 days straight, and then you'll actually finally feel better. If you feel super like crusty dry, like you're like you need to blow your nose, but it's all stuck up in there because it's real thick, you can use a saline nasal spray. Or if you get lots of nosebleeds nowadays, it's like around this time of year as well, a cool mist humidifier will be great. It's going to add extra moisture to the air. You're going to breathe in that moisture. It's going to make everything nice and wet, well lubricated, so you can blow your snot right on out, okay? Never underestimate the power of a really good hot shower. That just makes you feel like $1,000,000, and then your hair's all nice. And well, actually, let's be real. Day one hair is kind of a mess. It's not the point. However, take a nice hot shower. That'll help open everything up. Might help your aches and pains. And then put on some nice soft jammies. Having the flu does not necessarily mean a trip to the emergency department if you are generally a well person. You can manage this at home. And here's the thing. Do we have a medication for the flu? Yes, we do. It's Tamiflu. But you know what the side effects are? Nausea, vomiting, and diarrhea. I've had so many people tell me, yeah, I had the flu, but now I have all these new symptoms. Well, what'd you do? Well, I went to the doctor. They gave me Tamiflu. Well, there's your answer. Tamiflu may or may not reduce the length of time that you have your symptoms or the severity of your symptoms by about 8 to 12 hours. That is it. It is not like antibiotics. You will get better without the Tamiflu. The Tamiflu, like maybe possibly sometimes works, but it also has all these has this nausea, vomiting, diarrhea side effects to it that honestly, most of the time makes people feel worse. So you don't really need it. I don't like it. I am very against it. I literally have been taking care of flu people for 8.5 years now, and not a single person has said it was great. I felt amazing within a minute. Like, nobody says that. It makes everybody feel worse. It really does. And I stand by that. Nobody will convince me otherwise. Tamiflu just makes you feel worse. But anyway, it is flu season very clearly. You can take care of yourself at home without even needing to seek medical care. I know seeking medical care a lot of times can be a very big financial burden to people. This is a way to take care of yourself at home without having to see a doctor or go to the emergency room or even an urgent care. You can manage at home. If you have more flu-related questions, feel free to comment below and I will make videos. I'm also going to make a video about fever-reducing medications, so Tylenol and Motrin specifically for kiddos. Specifically dosing for kiddos. Like, the video is not for kiddos. The video is more for a parent taking care of a kiddo. Does that make sense? Okay. Anyway, more questions, post below. Good luck. Wash your hands. Cover your mouth when you cough. Good luck out there.